Well, winter's the perfect time to take care of those unsightly veins so you can stop wearing pants and show off your beautiful legs like Mimi here. Dr. Robert Thompson is a board-certified vascular surgeon with Vein Tech, and Mimi is one of his patients. Thank you guys both for being here this morning.
Thank you.
You know, I think winter's a good time to deal with those varicose veins and those spider veins so we can all hit the beach and feel comfortable. That's what a lot of people come to see you for. They want to have beautiful legs. They want to get rid of those unsightly veins. And there are a lot of different options out there these days.
There are two types of veins. The spider veins are more cosmetic.
Okay.
We can treat those with injections of different kinds of chemicals, and they'll be gone in a few weeks.
Okay.
The larger varicose veins are the more painful, medically necessary veins, and we can get rid of those in a couple of months.
And Mimi, that's what you had, right? You had the big,
yes.
I don't feel bad, I mean, the big vein. These are Mimi's words. She had the big varicose vein.
Vein, right, absolutely. And it was so unattractive, in fact, that my mother decided that you can
take a look.
see.
Look at your gorgeous legs. Absolutely beautiful. But before, there was a big green vein, right? And not only was it not pretty, it was uncomfortable.
It was very uncomfortable.
Yeah.
And I teach.
Mm-hmm.
So
you're on your feet all day.
I'm on my feet all day. And
so your mom sent you to Vein Tech.
my mother would complain about it every time she saw me, how
Really?
awful it looked. And since it was painful, I said, you know, I'm not one of those people that likes to just go get things done just for no apparent reason.
Right.
I always say I'm not that vain. So, it's not.
Mimi, that was a good one. I like that.
You like that?
That was good. So let's talk about what Mimi had done, because this is something you do for men, you do it for women, and it gets rid of that vein. A lot of people go, oh, that's got to be painful. It's not.
No, Mimi had what's the alternative to what vein stripping used to be, where you had to go in the hospital, general anesthesia, several incisions, several days in the hospital usually. Now we did her procedure in 30 minutes, local anesthetic, and she was home and to the beach the next day.
You went to the beach the next day?
I packed up and was on the beach the next day. I actually have pictures of that, but I'm in my swimsuit with my... I asked him before I left, I said, "Doctor, is it tan through?" And he said yes, but he was lying because I had a little piece
so you got a
dark skin
fine little sun bath there.
Gorgeous stocking.
I'm
gorgeous.
Of course, gorgeous.
But it was nude.
But you felt good. You felt good. Look at these pictures, because this is some of the things that Dr. Thompson is able to fix. So if you are at home and you've got a situation like that, don't live with it.
That's exactly right. These things can only get worse. They never get better. And the earlier you take care of it, the easier it is.
And again, that's a man's leg, obviously.
Yes, Shelley, that is not my leg. I just wanted to go.
His leg.
That is, yeah, that's what I was.
So yours was similar to that. Wow, that is, I mean, it looks painful just looking at it.
They are. People usually wait too long to come in.
Wow. Now, okay, so these are big varicose veins. Spider veins, easy to take care of too, just a small injection?
Small injections, similar to a TB skin test type needle, and several sessions to get rid of a full leg of veins.
And you do all the work inside Vein Tech. I mean, we just come in, we have the treatment, and then we're out of there.
Everything's done in our clinic, outpatient setting. We try to make it as comfortable as possible. Very little pain medications required afterwards.
Wow. So you're taking care, I mean, you're making your legs beautiful, and you're dealing with the pain. What creates the pain? What creates those varicose veins?
It's mostly the stretch of the veins when you're standing. The gravity causes the veins to expand, and that's how they get that big. And they just continue to get bigger the more time you're on your feet. That's why teachers, nurses, retail people, hairdressers, we see a lot of those types of people.
And what made you decide to finally, I know your mom was a big factor, but what really got you in there? Was it the fact that it didn't look pretty, or it was hurting?
A little of both.
A little of both.
I just, you know, when Dr. Thompson asked me to come today, I actually had to search my closet for dresses, because for so long I've just filled my closet with pants because of it. And I was a professional dancer, so I used to spend 10 hours a day in pointe shoes, and I wore skirts all the time. But after a couple of years, you know, my legs just didn't really like it so much, and so I was really embarrassed of what my legs look like, and it was uncomfortable.
Well, things have changed so much over the last couple of years, making this surgery just very easy. It's not even a surgery. It's all done with lasers and techniques like that. And, of course, I do need to congratulate you. By the way, Dr. Thompson has just been named one of San Antonio's best doctors by San Antonio Magazine. Yay. Congratulations. You can find him at Vein Tech, Varicose Vein Clinics on Medical, also on Stone Oak Parkway. For more information or to make an appointment, go to veintech.com or call the number on your screen, 483-8822, and we'll be right back.